Do we need tougher rules for people with mental health issues claiming sickness or incapacity benefits? Now, the Health Secretary, Wes Streeting, will today order a sweeping new review into why so many people are on sickness incapacity benefits, now amounting to 4.4 million working age adults. That's an increase of more than 1 million since 2019, pre-pandemic. Now, he wants to know if things like anxiety, depression, ADHD, autism are being what's called overdiagnosed. And if we're confusing everyday stress, genuine anxiety with mental illness. Now, we won't have the results for that report for over a year, but without reform, the bill for health and disability benefits is expected to cost £100 billion by 2030. So what do you think? Is getting a diagnosis life-changing, or is it getting in people's way in the workplace? Should mental health-related benefits be tightened, or do they need to be protected? As always, we want your thoughts, and I want to know if you've struggled to get a diagnosis, what happened after you got diagnosis, are you on benefits because of that diagnosis? So do you think the system is being abused, or is it not supportive enough? Get your calls in now. So, Marvyn, I want to come to you for this. What do you feel? Do you think we're diagnosing conditions that actually don't really need to be diagnosed?
I actually think we're underdiagnosing.
Right.
And I think the rate...
I mean, you're not alone. The NHS says the same.
The NHS says that, and my experience is I got diagnosed 3 years ago, and my experience up until that point was I was still highly functional, but I kept on coming up and tripping up in certain areas that were patterns, and I didn't understand why. And
so what's your diagnosis?
ADHD. And in the diagnosis, I just got tools. I got information on how to manage myself in the world. And in that, I've had a much better experience since that point. So I always advocate people to find out, not as an excuse not to do anything, but actually to find the tools of how you have to navigate the world. What we're also not talking about is the social contract that the government has had with the citizens has broken in such a way that many people are disillusioned with why they should continue working through what they intuitively feel and understand in their bodies. And that's something that you cannot neg people out of. You can't just go around being like, you're lazy and we're overdiagnosing and you're a burden on the NHS. Actually, what we have to figure out is how do we create a new society based on the people that are actually in it that maximizes what their skill sets are. I have a unique set of skills that are underserved in society because actually society doesn't even know how to bring the most out of people who are creative first, who are intuitive and have a deeper sense of feeling. Those things are completely missed. So I think we lose out on great roles for those people, and instead of getting everybody to go sit in an office in front of a computer for 8 hours.
Before we get Larry's thoughts, do you think that part of the problem is that this, let's call it overdiagnosis, perhaps, even though, and the NHS agrees with you, Marvyn, the NHS thinks there's way more...
very smart people.
There's way more people out there that are not being diagnosed. But do you think that there is an abuse of the system in which, and we should make it abundantly clear that just because people are getting an ADHD diagnosis, that doesn't necessarily mean that the next thing they do is go and claim some sort of benefit. Many people just need the diagnosis and get on with their lives. But do you think that there is an issue with too many people claiming benefits for mental health issues that actually shouldn't really get in their way of living a normal life and doing a normal job?
Every system that doesn't work for people will be abused. So even expenses scandal that happened 15, 20 years ago, that was a system that was then abused by a group of people and it got changed, right, and updated as such.
You're talking about the MP's expenses scandal?
Yes.
Okay, fine.
Every single system is abused in some way by some people that it doesn't work for. If we centre our whole policy on that small group of people who benefit from a system that serves many, then we will never build anything that is sustainable. Okay. And that's why I say we have such short-term thinking in this country, such a worry on pennies that we actually end up wasting pounds navigating.
I want to hear what Larry has to say. What do you think?
I think this is a financial issue in the sense that we cannot afford this. We cannot continue. Now, like Marvyn, I would agree, actually, I think there is actually underdiagnosis. In my family, in the last 2 years, I think we've had 3 autism diagnoses and maybe 4 ADHD. So we're all a bit weird in my family, but none of us are on benefit. So we took the diagnosis. I'm the one of the few that's not diagnosed, actually, but anyway. But I don't think that means a golden ticket. That means I don't have to work. I think what we need to do is decouple the idea that you get a diagnosis. Because, to be honest, on the NHS, it's very hard to get a diagnosis. All my family had to go private because we couldn't afford to wait, and it's cost a lot of money to do that. So I think it should be that we continue to diagnose people and offer them help, but we don't view it as a disability. ADHD is not a disability. It's a different way of seeing the world. No. It's a different way of seeing the world. Lots of people have different ways of seeing the world. When you go into a workplace, you might want some adjustments for you, but it doesn't mean you cannot work and you cannot contribute.
Okay. It is a disability. It's important to say it is a disability.
I don't agree.
And it's also important to make sure people know that being neurodivergent doesn't make you weird.
Okay, let's speak to people at home. Fiona is in Lancashire. Fiona, welcome to the show. What are your thoughts on this? Let's deal with the idea of overdiagnosing. Do you believe that's going on?
No, I don't. I think lots of people have mental health problems which are undiagnosed. So that's separate, like Lowri said, to the situation we've currently got in the NHS.
Yeah. Do you think that one of the problems of what Lowri was saying is that people get a diagnosis and perhaps not all, but some think, well, how can I use that diagnosis to claim some sort of benefit?
Absolutely correct. I've got personal experience of that, multiple occasions.
Okay, tell us about your experience. Do you work in the NHS?
I do work in the NHS, yes.
How does this manifest itself? What have you experienced?
So people are on PIP already and they're scared they're going to get taken off it because they've been diagnosed as, better and they've recovered because of anxiety and depression. And I've actually been threatened personally because they say, do not put that in my record because I want to stay on PIP. Or the social worker gets involved to sign them off. There's a lot of people involved in taking a diagnosis away, which we're not talking about, i.e. somebody is now healthy, recovered, fit for work. But the problem is we're getting into a dependency culture where people are using it now to stay on PIP. And this has got to change. And there are ways of doing this. We could get more CBT in the community.
That's can you explain what CBT is for people who might not know?
Cognitive behavioural therapy.
Yep.
We can have more social groups. We need to put it back in the community. The problem is this is bed blocking. So if we've got somebody who's refusing to leave the hospital, that is a bed we cannot use, and it costs a lot of money because you've got social workers involved, you've got nurses involved. And ultimately, there's somebody in A&E who needs that bed.
Yeah, I mean, there's another conversation that's happening this morning. Jeremy touched on it as well, people going to A&E and, of course, using up a bed that perhaps other people will need. So in your view, Fiona, what do you think we need to be doing? Fiona, are you still with us?
I am sorry, I lost you a little bit there.
In your view, what do you think needs to change? I mean, Marvyn was talking about a system that sort of doesn't quite work. I mean, it doesn't sound right that people actively want to stay on personal independence payments and don't want to get better and be able to go out there and get a job. But for some people, that's not going to be the reality. So what do you think needs to change?
I think there needs to be tougher rules on what is classed as an access to PIP. So, for example, anxiety and depression, everybody in their lifetime will experience anxiety and depression. There's no getting away from it. It's life. The concern I have from a medical point of view is if you've got suicidal ideation. Now, that's a red flag for me. But there are people on PIP who just have normal anxiety and depression, which can be medically treated, and it is a period in their lives which, with support, they can get through. They don't need to be on a benefit. In fact, working helps. It gives you structure. It gives you something to get up for in the morning. You're getting paid. You're not dependent on the state. You can have a better lifestyle in most cases. But for some people, I feel it is just a way of remaining on benefits. They don't want to work. They don't want to put any their money into the system. And they're lazy.
I think, Fiona, there's also an identity thing going on here. I look at my own teenagers and they identify themselves by what they've got. So they will often say, oh, I'm so-and-so and I've got anxiety, depression. I'm so-and-so and I've got ADHD. And it becomes really part of their identity, and they'll kind of like one-up each other. Well, you've got borderline personality disorder. And that, anxiety, depression, you can get better from. When you get a diagnosis of ADHD, it's not curable, But again, it doesn't mean that you're disabled and you can't work.
Okay. Fiona, thank you. I'm only moving on because so many people want to have their say. Neville is in Manchester. Neville, welcome to the show. What do you want to say?
Hi, good morning, panel. Fiona, the previous caller, was just a breath of fresh air to me there. She's absolutely right. I mean, I do have emotionally unstable personality disorder. That's, stems from traumas in childhood. I've always, from being a child, from being around about the age of 11, suffered with treatment-resistant anxiety and depression. And it's clear the whole system needs, not just the benefit system, but the whole NHS mental health system needs a complete rehash. I mean, we've got first point of contact services that are just useless. I mean, the amount of admissions I've had for 6 weeks to 22 weeks, and I've come out of there, if not worse than I went in, exactly the same as I went in, because you're clumping too many people with too broad a set of mental health illnesses from all ends of the spectrum into one pot, and it's understaffed. You don't get the quality of staff that you used to get anymore, and it's a joke. It leaves people like me out of that loop. I mean, I've been waiting for nearly 10 years for not just CBT, but for EMDR therapy. I've worked pretty much all my life. I mean, I was a health and safety advisor on major events for nearly 20 years. But when I got ill, I got seriously ill. And it's something that, in those cases, it's something that doesn't leave you. It's a benefit system that really needs to deal. It's got to be linked up directly with the GPs, a psychiatrist, a psychologist, and a community and mental health worker. It can't just be left to the government to decide to make these or some entity that they pay in the background to come in and make these decisions on, okay, tick that box, tick that box, tick that box, you deserve a benefit.
Neville, what I'm hearing from you is that this isn't necessarily about how the benefits work. This is about a lack of strategy that the government have put in place to deal with mental health people. There isn't a benefit challenge, but in that there is a lack of a process as to what to do with people at different stages of their mental
sorry to interrupt. That has the biggest impact on the benefit system. It's all well and good. Any government of the day. I mean, let's not forget. Both governments just sat aside whilst everybody's mental health was affected by the drop off the cliff with COVID. But what the benefit system has never done is linked directly in with the NHS.
Yeah.
And that's what has to change. Okay, Neville, I'm going to leave it there only because I need to squeeze in a few more callers. Thank you for getting in touch. Nikki's in Cheshire. Nikki, welcome to the show. What would you like to say?
Right, as a retired primary school head teacher, what I want to say is that we must not go back to an age where children are not being identified whilst they're in school. If children were identified, particularly with ADHD, and I had a special unit in my school as well, if they're identified early, then they learn how to cope with that. And so they don't have the mental issues as they get older. What I am totally against, though, is the number of parents that I'm still sort of in education, even though I'm a lot older now. But I do know that a lot of parents will go online and they will get, they'll go online for an ADHD test. Yeah. And then go into school and say, well, my child's got ADHD. It needs to be identified properly.
But Nikki, you can understand the frustration when we read that there's 800,000 people waiting to get those diagnoses. And I think that's a conservative estimate from what we've been given to understand. So I know how you feel about the parents going online to get their diagnosis. But on the other hand, you kind of sympathise if they've been waiting for years and nothing's happening.
Look, I'm involved with a child who's been waiting for the local council to identify a child and get an educational healthcare plan. So I do know that. But I know that if it's parents that are saying my child is ADHD, it's, and I know that they can't always go and afford to have a proper assessment done. I know that. But I do believe that it is making the situation worse. Yeah. And causing anxiety with children. listen, I've worked with children who've had a lot of anxiety coming into school and know what it's like for them. And I think that the problem is that the system, in society isn't allowing these children to be identified formally and properly. That's where the hiccup is coming.
All right, Nikki, I've got to leave it there only because I want to squeeze in Natasha, but thank you for your call. Natasha is in Surrey. Natasha, welcome to the show. What do you think? Do you think we're over-diagnosing people?
I think so. I think tougher mental health rule benefits absolutely need to be in place. I mean, for the genuine people, my sister has rheumatoid arthritis. It's impossible for her to get a disabled badge. The hoop she had to jump through to get a diagnosis was just crazy. And then I think, on the other hand, you've got people that turn up at doctor's surgeries and say, "Oh, I'm a little bit anxious with life." And they
I think it's as easy as that, Natasha, because that's the problem. A lot of people are waiting to get diagnosed. But do you think that perhaps we need to have tighter rules on who is entitled to payments depending on the level of mental health? So ADHD, for example, from what I understand, Marvyn, is that there's mild, moderate and severe. Now, severe means you can't function in a professional environment. Therefore, perhaps you do need some help.
So for me, it's how much money you receive and how long you receive it for should be a question, right? At the point of diagnosis, there's a period of transition, which if supported, for example, a really good example is if you are diagnosed with cancer, there are charities that are immediately plugged into your care plan and it is synced with the NHS. And as a result, you get this integrated care that does not exist in many other worlds.
Right.
So that is a...
We need to think of the same.
But we also need to zoom out and say, this is costing a fortune. The amount it's growing is scary. This cannot all just be the fact there are more people with mental health. Something else is going on here that does need to be addressed.
One of the stats, I will leave it there, that jumped out at me. 8.9 million, just under 9 million people in the country are on antidepressants, which there's a number to think about. Thank you, Natasha. Thank you to all of you for your calls and your messages. We've got to move on, though, now.